very important, and it's very important to talk about it. And I think for probably years it's been a bit of a stigma topic and we don't like to talk about it, but I think there's a lot more focus now on different kind of diseases that lead to a lot of mental health distress, and I think we just don't talk about it, and even our clinicians don't actively take interest in actually saying that this medication could have certain side effects that's going to affect your mental health, or this will have a lot of burden on your day-to-day activities, which will also impact your mental health. So I think it needs to be brought into a very daily conversation, especially with your healthcare practitioners. And I think we need to kind of improve that awareness, not through them, but also through wider organizations where, if you have charity organizations or patient organizations, if they can talk more freely about it, that would be really helpful.
A lot of the things begin in the mind and also in the gut. I think we are aware of that, and I actually do believe this should be coverage for mental health issues. It's long overdue, in my opinion. I think a lot of the things we're seeing, for example, that are, let's say stress-related, that manifest in the physical body, began in the mind. And I think before, in an effort to also avoid treating conditions and also providing solutions, is to start first with sorting out what is going on with the mind. So treating any kind of, anxiety-related issues, depression-related issues from the early onset before proceeding to treat other illnesses. Yeah.
In terms of mental health and health promotion, this is a bigger space that we've been operating for the last 2 or so years because of the challenging issues of health and avoidable issues that we can control through promotive services. And we are using mental health as a key pillar of health promotion in ensuring that we're able to address some of the concerns, some of the issues that one would want to be addressed, like having someone whom you can simply speak to, or having someone who can help to correct most of the healthcare illnesses that could be controlled just by counseling, just by getting an advice or getting someone whom you can speak to. So we look forward to improving delivery of services around this area, because if you look even to our healthcare workers, there are many that are experiencing mental health issues, but they lack someone whom they can speak to so that they can get either assistance. So it's an area that is very broad, and as the ministry, we are coming up with a clear plan to make sure that no one is left behind in promoting preventive healthcare. And so in the coming days, we'll be having implementation happening both from the national level, county level, and communities, to make sure that we have a clear platform for mental health care, a platform where people can get care other than depending on treatment or getting care from the facilities.
Yeah, I really think it's important for it to be compulsory, because mental health is just as important as physical health, and it affects literally everybody. So I think that will be a very key milestone for us as Kenyans and Africa to have this mental health coverage universal and compulsory in all health centers, because it affects you, it affects me, and we need to put more, we need to join forces so that we can make mental health accessible for everybody.
Okay, I think first of all, it is important for us to outline the fact that when you think about health promotion and universal or overall health wellness, it does very primarily begin with mental wellness. And mental health is an issue that has been explored quite extensively in the recent past by private companies, by civil society, but it's also being taken extremely seriously by the government of Kenya through the Ministry of Health. And of course through the health promotion docket. So our opinion, or rather my view on what mental health wellness promotion is meant to achieve, is that it's an integral primary starting point for the pursuit of universal health coverage within the region. The better ways we think and manage ourselves is the better way for us to be healthy in our bodies and in the way we live.
So I think for mental health, I think the essential thing is that, first of all, most people with mental health problems did not know they were going to have mental health problems. So sometimes they depend on family, on infrastructure, on other things, but they often felt a stigma around it. And that is where sometimes we need to have more mental health provision and intervention to actually make sure that we actually scan where the mental health problems are, because there's not one shoe that fits all. Individuals experience mental health problems very differently. Some people might never feel it, and some people it comes unexpectedly, maybe because of stress, because of external impact of things they had no control over. But it is important that we also have governmental interventions to actually support mental health. This cannot be solved just by family and friends alone. So that is where we really need to have more push towards mental health provision. I think in Europe there are some good facilities, but I think again it's important that it's different interventions depending on what the mental health problem is. So we do have a government intervention, but at the same time it's not only the individual that needs to be treated. Somebody like a family, a network also needs to understand how they can best improve and support that individual with mental health problems. So I would say that is something we need to understand. It's not just treating the one individual, it's actually what is the environment they're working in and how can we support that more. And that's really where we need to have more emphasis. It's sort of a holistic approach to mental health.
When we look at mental health, we need to look at beyond the health and see how to look at it in a broad base, in such a way that we teach issues to do with the financial management. We look at issues of ensuring that at the workplace the environment is also conducive to work, and also ensure that generally, economically, all the other hardships people are cancelled to undergo the difficulties that they are going through that may trigger the mental problems within our society.
It is high time, I think your question is leading to, it is high time that we need to include mental health within UHC. And I think it's critical because many times you have mentioned about the cases that are now happening and are now becoming more prevalent. And it's because sometimes when you go to see a doctor, what's the first thing he'll tell you? Where are you feeling pain? But I think sometimes the doctor should ask you, how are you feeling? Are you okay? Because that then triggers a mental health related question. But many times we think it's any other part of your body other than your mind, where we come to understand actually your mind impacts everything about your body and your health. So I agree with you, mental health needs to be under UHC, and I think it's something that we all need to embrace. And I hope even as the viewers are watching this, they need to ask themselves, are you okay? Because sometimes the illness you're facing is because maybe emotionally and mentally it's impacting how you view life, and hence it needs to be included within the UHC. Yeah.
I think we are looking at the well-being of the whole individual, and part of the challenges that the individual will have is basically physical health and also mental health. So we can't just naturally just be focusing on the physical health. We also need to be able to look at these particular silent health issues or silent mental health issues that affect the whole individual as a whole. So increasingly we found that as much as you're addressing health issues, the person could be healthy, but there could be so many other mental health issues that they are going through that are unseen, and we need to be able to bring these issues into light, to be able to create awareness on these particular issues, so that as much as we are addressing other health issues, we should also be looking at how to address the mental health issues that affect individuals. I think in our experience as TICO, coming from the organization called TICO, as we work with our adolescent girls, we are able to address some of the key issues that they are going through. We are trying to prevent teenage pregnancy. policies. We are trying to make sure that we address issues of gender-based violence. But increasingly, we've really realized, as much as we are doing this, the girls are really traumatized that they've got mental health issues that need to be addressed. So we might be able to plug the gaps on these other issues, but if we don't address mental health, then we're not holistically serving that particular girl or that particular individual to make her live her life to the fullest from all aspects.
One of the biggest concerns as we talk about health promotion in this conference is the need to move from treatment to preventive. And when we talk about preventive, we are talking about how do we make sure that the number of people that check in the hospital seeking for treatment is fewer. Because most of the cases that go to hospital, they are cases that can be prevented. They are illnesses that can be stopped. And if you can imagine what would happen if we are able to cut down the number of people who go to seek medical treatment by 50%, so that in each hospital, in each dispensary, the number of people turning up is reduced by half. That would be great gains in terms of investment, in terms of money, and it would be also be great gain in terms of productivity, because these are people who should be working, and it should be saving a lot of money also for communities, and people are able to take that money and put it elsewhere. Now, for that to happen, then we have to ask ourselves, what are the causes of illnesses? Illnesses are not just caused by bacteria and other microorganisms. Illnesses, as we know, it's about the human body failing to function the way it should function normally. And when our mental state, our mental well-being is not stable, there are many things that happen to the human body. Number one, a person who is mentally disturbed is a person who also suffers from a depressed immune system. So stress, for example, is known to be as strong as HIV/AIDS in suppressing the ability of the body to defend itself from any attack of microorganisms. And that's why at any time when a person is undergoing through a stressful moment or mental agony of any form, whether it's financial, whether it's related to social factors or economic factors or job related, then those people are more susceptible to things such as cough, things such as ordinary flu, and also other more serious sicknesses. And therefore, it is coming out very, very clearly as that one of the social determinants of health, good health and well-being, is the mental well-being of everybody. And therefore, it is important that we address this. And this mental well-being, these social determinants, this conference has able to isolate quite a number of things that contribute to it. Top among them is domestic violence. Domestic violence, whether it is against women or against men. That is a major cause of stress and is a major cause of illnesses or depressed defense of the body against illnesses. Others, of course, are issues to do with the nutrition, the type of food that we eat, and others also include climate change, which is also affecting the way we live and what we eat, and also affecting the weather around which we live. So mental health, including all its effects, it's supposed and should be, and is a major pillar of universal health coverage. Without addressing it, we cannot reach everyone.
Make sure that the same way we are championing for affordability, accessibility of other services, then also we should be able to champion for accessibility and affordability of also mental health services, because as it stands now, not many people are even aware that they need the mental services. Most people can't afford the services, so you find people that could be treated or situations that could be arrested go a long way, or people even die out of them because they couldn't afford the service. They're ignorant of the mental issues or even the indicators of it. Yes.
Having a universal mental health coverage is very important, because it means if we are able to integrate the mental health into our healthcare system, then that means it's going to be very easy for us to achieve the set target of ensuring that everyone has been covered with the current Taifa care that we are currently having. At Thales Psychotherapy, we have been able to make great milestones in terms of integrating the care with the current systems that we already have, ensuring that everyone is not left out, everyone is being screened, and early prevention is being done to reduce the level of curative mental health care treatment. So we are calling out on all mental health, not mental health, but on all policy makers, on the policies that they've already been able to put down for mental health, that they are now being taken to the ground and being activated.